Thank you for joining us today. We are going to dive into how different attachments impact behavior in elementary children by sharing research associated with attachment development and consideration of minorities, associated behaviors of attachment styles, and methods of treatment and intervention. As well, we will share an important development in measuring attachment in elementary age school children. We will first inspect attachment theory as influenced and developed in middle childhood as relevant to the field of counseling with research done to assess the behavioral impact of attachment styles on overall socio-emotional or relational functioning of elementary students. Second, we will discuss cultural considerations of attachment styles and possible impacts on minority populations as implicated from a synthesis of an article from Agustin and Brumbaugh and the article by Candelaria et al. Third, we will look at how different attachments impact the behavior in elementary children and how clinical counselors address these behaviors as discovered in articles from Embury et al. And Boris et al. Then we will address our group's hope for future research with implications from the preliminary findings of a new tool for measurement of attachment styles of elementary school children. Lastly, we will summarize the findings from the project and awareness as counselors to support positive development of attachment in elementary age children.
The correlation between attachment and mental health is important for counseling and psychotherapy. According to Way, attachment theory serves as a solid foundation for understanding the development of ineffective coping strategies and the underlying dynamics of a person's emotional difficulties. According to Inhofer, research shows that most children enter therapy or counseling with one of two attachment styles, either an anxious, ambivalent attachment style or an insecure attachment style, both of which occur in children who have serious psychological disorders. These children are often very fearful and show inadequate behavior such as antisocial behavior or aggression. When children with a secure attachment style engage in therapy, they disclose themselves easier and are more open to reflection in therapy. Securely attached children engage better with counselors due to their high ability to do constructive work in therapy as they learn to use adaptive strategies to deal with their issues. Attachment styles also play a major role in determining the length of therapy. Research suggests that children with a secure attachment style have a better outcome when provided with short-term therapy of 10 to 25 sessions, and children with an insecure attachment style benefit from a longer psychological and therapeutic treatment. According to Gardenhire, although insecure attachment styles may be reflective of a destructive internal working model, insecure attachment styles are not necessarily a permanent condition. Children who have attachment issues can benefit from counseling to learn what healthy relationships look like, explore ways to form a positive bond with caregivers, and develop ways to cope with the symptoms that result from their early attachment issues. Regarding the research by Goldner and Sherdiff in their article titled Attachment, Security, Personality, and Adjustment of Elementary School Children, we see how attachment consideration is relevant to counseling because the study of attachment is the exploration of the development and maintenance of interpersonal relationship. Goldner and Sherdiff distinctly identify the impact of attachment and children's functioning by input from children's parents, and teachers from 19 different elementary schools by way of various questionnaires and analysis. The study found significance in the effect of attachment security of socio-emotional functioning by analysis on children's reports of social self-concept, conduct self-concept, and depression, and the parent and teacher reports of children's social functioning, conduct problems, and emotional symptoms. They found securely attached children demonstrate higher levels of social and positive conduct, perception and lower levels of depression than insecure children. More so, securely attached girls demonstrate higher levels of social functioning and lower levels of conduct problems than insecure boys. Therefore, Goldner and Sheridan article gives counselors insight into the importance of understanding the impact of attachment on elementary school children, internal feelings, outward behaviors, and consideration to examine children as an individual in order to counsel a child's personal strengths and areas for growth. Unfortunately, the research did not consider the different styles of attachment and suggests that future research needs to be done. Next, you're going to hear from Joanna.
So we know that attachment is a biologically based system, which means it affects everyone. But as with many other issues, it's important to recognize the impact of this topic on minority people and cultures. The following studies are not focused on specifically elementary age children, and that's just because there's a lack of research that looks at attachment and how they manifest in minority elementary school children. But by looking at the factors that cause negative attachment in adult and infant minorities, we can make educated assumptions as to how we can help elementary school minorities build healthy attachments. The first study we're going to look at is from 2013, and it's by Augustine Brumbog. The study examines culture's relationship to attachment. The authors say that it's clear culture influences attachment, but to what extent? The authors propose two hypotheses. First, individuals with higher collectivism, meaning they come from countries that value the collective over the individual, would display greater anxious and avoidant attachment. The second prediction was that African Americans would have a higher proportion of avoidant attachment compared to other ethnicities. 475 psychology students from Queens College, one of the most diverse colleges in the U.S., participated in the study. In order to determine attachment patterns, the authors had the subjects take the Experiences in Close Relationships Revised questionnaire. This questionnaire assesses attachment, avoidance, and anxiety, and then yields the results for both anxiety and avoidance. The results of this study concluded that people of different ethnicities and regions varied in attachment distributions. Specifically, individuals from Asia displayed higher attachment anxiety than individuals from all other ethnic groups. So the hypothesis regarding collectivism and attachment anxiety was corroborated. Collectivist cultures display more attachment anxiety. The hypothesis that African Americans would show more avoidant attachment was not supported, but this is believed to be because of the particular population they used in the study. This study used college students as opposed to older people or low socioeconomic status individuals, two groups who tend to be less securely attached. So how is this study of diverse college students relevant to our topic today? Knowing what we know about attachment in Asian cultures allows us to have a multicultural awareness that allows us to see the potential difficulties in the social problems of that culture and supply interventions that improve the parent-child relationships and therefore the course of attachment in a child's life. The authors also mention it's important to address this issue carefully, though, because the Western ideal of attachment is not necessarily the desired version of attachment in other countries. The authors say it may be useful to examine when insecure attachment does or does not lead to negative outcomes, regardless of the culture. An idea for future research regarding this study is asking, what does creating secure attachment with children from collectivist cultures look like without dismissing the value and beauty of their culture? The second study we looked at is by Candelaria et al. The study asks, how does socioeconomic status, mental health, infant health, and maternal sensitivity affect a child's attachment style? In this study, 112 premature infants from socioeconomically disadvantaged African American families and their mothers were recruited to be part of a randomized controlled trial that examined the efficacy of an intervention with the goal of facilitating healthy infant development. In this study, the goal of intervention was to increase infant secure attachment, parenting skills, and development. Through home visits, the risk factors and maternal sensitivity were scored using the Maternal Behavior Q-sort. This test correlates significantly with the attachment score and the Ainsworth rating scales of maternal sensitivity. The attachment security was measured using the attachment Q-sort, and this test captured affective, cognitive, and behavioral aspects of attachment. Both the AQS and MBQ scores were negatively associated with the sociodemographic and psychological risk. In other words, the more economically and psychologically disadvantaged mothers are, the more risk infants face in becoming insecurely attached. However, when maternal sensitivity was added, risk factors were significantly lowered. This is an important point to note because even if an infant is in an environmentally risky place, maternal sensitivity can alleviate those risk factors significantly. This is relevant to our topic because we know that multi-stressed infant mother dyads are at risk for developing unhealthy attachments. And when infants grow up with unhealthy attachments, they're at risk for behavior issues that stem from their socio-emotional difficulties. So when it comes to minority elementary age children, unhealthy attachment and therefore behavior inhibits learning and healthy development. In school, there must be interventions in place to address the behavior in order to make positive changes, and better yet, there needs to be more programs that assist mothers of disadvantaged status so healthy attachments can be formed. Future research questions could be, what do these interventions look like in schools? To recap, certain minorities are at risk for insecure attachment because of their circumstances, and as future counselors, it's our responsibility to address these disadvantages and not sweep them under the rug. Now we're going to hear from Melissa.
Thanks, Joanna. Moving right along, I will now be discussing how different attachments impact the behavior in elementary children and how mental health counselors address these behaviors. In order to have a solid understanding of different attachments and their effects on behavior, one must really understand how it all begins. In a 1998 study by Boris, it was determined that infants diagnosed with attachment disorders had lower levels of relationship functioning than infants diagnosed with other clinical disorders. According to Embry, disruptions to the attachment cycle can result in a range of symptoms from minor attachment issues to an actual diagnosis. These can vary significantly depending on how a child's attachment cycle was interrupted. Some disruption causes include caregiver depression, frequent moves, lack of physical nurturing, maternal drug and alcohol abuse, maternal sexual abuse, and maternal emotional abuse. This early disruption in the attachment cycle can cause changes in the quality of relationship attachments for the child. These disruptions can also cause brain changes and differences within the child. According to a study by Embry, Clark, and Lever, neurological findings have demonstrated structural and functional changes in the brain for children with these kinds of experiences. The early attachment experiences and the environment that produces this early trauma for infants and young children affect not only their social and emotional development, but their brain structure and development. This leads to long-term effects on the child's brain and behaviors. Because attachment disorders can start in infancy, it is important that the attachment disorders be diagnosed as soon as possible, as an undiagnosed attachment disorder can delay in treatment and can lead to lower levels of relationship functioning. Some examples of attachment disorders include insecure preoccupied attachment, which creates a cognitive disconnection that causes the adolescent to feel frustration, anger, and then has the inability to understand the catalyst of said behavior. More of a positive attachment is secure or autonomous attachment. This expresses a general trust in parents, teachers, and other children. These children are able to acknowledge and reflect upon both positive and negative experiences. Another attachment disorder is defensive exclusion detachment. This is associated with insecurity and the inability of the child to focus on personal needs. The child exists in a personal state of denial, and they tend to minimize the importance of parents and teachers. For mental health counselors to implement the best therapeutic interventions, the mental health counselor must be well-versed on attachment theory. According to WE, attachment theory is a theory of affect regulation in interpersonal relationships. When individuals have caregivers who are emotionally responsive, they are likely to develop a secure attachment and a positive internal working model for self and others. Some of these interventions include individual therapy and positive behavior. According to Du Bois, the main objective of attachment-based therapy is to support the patient in reevaluating and restructuring insecure attachment representations by using the therapeutic alliance. In this particular intervention, the counselor must be a secure attachment figure, must be sensitive and supportive, must be available and responsive, and must be encouraging and foundational. Regarding positive behavior, also known as PBIS, it is the implementing of positive behavior interventions and support systems that can be used for children of all grade levels to make expectations, consequences, and rewards clear and consistent, according to Embry. Some things that must be included during these interventions are the building and fostering of trust, a reward system, stellar communication, structural but positive environment, equally sensitive to the parent and child, must impose conflict resolution and step-by-step instruction. Clinicians, according to WE, not only need to focus on changing maladaptive coping strategies, but also need to understand the underlying unmet needs that are satisfied by the use of these strategies, as well as to help individuals learn alternative ways to satisfy their psychological or emotional needs. Moving on to biblical perspective, I'd like to note Romans 8:28. And we know that in all things God works for the good of those who love him, who have been called according to his purpose. The assistance that counselors provide for others can be considered godly work. Attachment theory pertains to the individual's personal bonds and with others. Just as people seek the Lord seeks people. People desire to give and receive love from the Lord. Once those personal connections are made and met, a bond is formed, and solidifying the attachment between the person and the Lord has now commenced. It is very important that as counselors we act upon the best interests of our clients and do so while keeping a firm biblical perspective in focus. And now on to Tiffany.
Thank you, Melissa. Our group discovered gaps and inconsistencies in the research, specifically a lack of studies addressing attachment in elementary students and elementary minority populations. Whereas Gardner and Sheriff's study found that ethnicity was not a variable, studies on older populations suggest significance in difference of attachment styles. Fortunately, the Child ASI, or Child Attachment Style Interview, was developed, implemented, and the preliminary findings of the validation study were published in 2021. The Child ASI was adapted from an existing adolescent-adult measure and tested on children in primary school and children in foster care aged 6 to 11. The test was designed to be given in a school setting and for investigating trauma-related interpersonal problems at an early stage and specify secure, anxious, avoidant, and disorganized attachments among the children. As you can see, there is a pressing issue with attachment styles of children in care compared to their peers, as only 10% of the children were found to have secure attachments compared to 62% of the primary school sample. Thus, our group discovered the deep and meaningful relevance of attachment styles in children's development of interpersonal relationships and how they may present differently between girls and boys, and we discovered the necessity of considering personality traits as influences to behavior seen from attachment styles. Our group also identified the need for counselors to be aware of cultural disparities in secure attachment styles among people with African American and Asian ethnicities or relevant collectivist culture influences. Also, we examined how different attachment styles among elementary school children present in general, from secure to insecure attachment styles. We looked at possible causes of disruptions to the attachment cycle and that implementing positive behavior interventions and support systems are successful methods of intervention as well as earning a secure attachment with God. From prior learning, the team's thoughts are that attachments are mostly formed from birth to 18 months, and we appreciate the knowledge we have acquired as to help elementary students' behaviors through counseling to improve attachment and cognitive self-regulation by setting goals for students and families. Overall, our group finds it is necessary that further research is needed to discover the impacts of attachment and the potential for more specific techniques, interventions, and programs developed and implemented for counselors to additionally address and curb insecure attachment styles of the elementary students of all backgrounds. And we are hopeful that the Child ASI will open the door for earlier intervention and healing to occur by assessing attachment styles with minority and cultural considerations. We thank you and appreciate your time with us through the presentation.